My name is Gerry Pape. I'm part of the Stewards of Change team. Today's panel, we have two topics. We're going to have a discussion of the challenges of an inclusive and accurate case record, and then we're going to talk about lessons and myths of agile system development. To do that, we have two teams. Herb Quinde from Microsoft will partner with Maureen Ellenberger, formerly from the Department of Veterans Affairs, on the discussion of case records. And following that, Mike Wirth, Chief Architect for CGI, will partner with Judge Jim Payne, currently Senior Advisor for PCG, to share lessons on agile development. You can read the bios that's in the printed material, but like Adam earlier, I'd like to share a little tidbits. It's after lunch, so we got to keep people awake and offer a little interesting things. So let's start with Herb. Herb belongs to a theater group, so we all need to be checking for facial expressions, body movements, and arm waving. And he's excellent. He also shared that he's in a doctorate theology program, and that he recently found out he's not just Latino, but he has Viking in him, Viking heritage. Maureen left Veterans Affairs in April. Since then, they've bought a house in Santa Barbara, California. One of her many full-time jobs now includes lengthy discussions with the city of Santa Barbara and the Coastal Commission on what they can or cannot do with the house they just bought that needs a lot of work. Mike's claim to fame is having worked with Secretary Bill Hazel for 4 years and survived. He claims his hair loss on top of his head is a direct result of the need to grow hair on his face. I must tell you, Mike, that I did share with Dr. Hazel, Secretary Hazel, your comments. He had some equally supportive comments on who survived who. Lastly, Jim Payne, being the humble man from Indiana, doesn't want to talk about his 20 years as juvenile judge, or over 7 years as head of Indiana's child welfare. He wants to talk about three other numbers: 48, 2, and 10. 48 years of marriage, 2 children, and 10 grandchildren. So congratulations. So with that, let's get started. And Herb, it's all yours.
Thank you, Gerry. So folks, the first thing that I wanted to do is Martin Luther King has a famous quote. I'll try to paraphrase it. The arc of the moral universe is long, but it bends towards justice. And I was reminded of that as I sat here this morning and looked at everything that's being developed by our artist friends here, the discussion that happened yesterday and this morning, and really 10, now 11 years of progress. And so I'm very, very optimistic about what it is that, that we do. But there are challenges. We all know that there continue to be challenges. I recently joined Microsoft. I'm going to just complete 2 years being there. And that's been a real change, having been previously a government official in Illinois and tackling the Affordable Care Act and all of the challenges there. And prior to that, I was in the commercial arena doing IT work in the federal government and defense intelligence and so forth. And so what I wanted to do is to look at some of the challenges that we have, and maybe what might be not a silver bullet, but certainly something that should spark some thinking about how we solve the problems that we continue to have in some of the impediments that we have in being able to move forward on the mission that we're all dedicated to. Right after 9/11, I was working in IT in federal projects. I was on probably several of the top major projects that failed right after 9/11, which were attempts to integrate data across all of the intelligence community and defense community to be able to share data. And Shmendra Paul and Steve Ambrosini here gave us an insight about how that was solved. So basically, a decade later plus, that problem is significantly resolved, right? So how did they get there? And so the insight that I want to share with you is that when I was working on these projects, I was part of an informal group of IT people in architecture working with one of the three-lettered agencies that's this side of the Potomac River, and got to meet with some of the executive leadership, and we had a bunch of different meetings. And one of the things that I learned was that at that agency, the No Such Agency, Nobody with a math degree or a computer science degree or an information sciences degree is allowed to run a project. Interesting, right? So ask your question why. So who do they want to run projects? What do you think? Program people? What would you think? What are the kind of people that you need? Project managers. Okay. The only people allowed to be project managers at that agency are engineers. It doesn't matter whether you're a mechanical engineer, whether you're an industrial engineer, whether you're an electronics engineer. Why? System of systems. You have to be able to think in complex systems of systems. You can't think about specialization. You can't think just one thing. You can't be proficient in just one thing. You have to be able to solve a really big problem is what we have here. And I think that this is really part of what Stewards of Change does. When we were in Illinois, I was the chief of IT policy and planning in Illinois for a couple of years when we were getting ready for the Affordable Care Act. The way I got to that job is that before that I was actually the CIO of the prison system, which by actually, thanks to the FBI, I got my job because they busted Governor Blagojevich. I had a friend who was working for the new governor, Governor Quinde, and they had a crisis with their prison system, and it had to do with a mainframe. They wanted to blame the computer for the fact that they had released early 2,000 prisoners. And they went out and did really horrible things, and the governor almost lost his election. So I was hired to try to solve that problem. And what I wound up doing was discovering something called customer relationship management. And so what I'm going to do is I'm going to try to tell you about how that all works. Am I going to be able to skip over this video? Because I don't think I need it. Yeah. What we wound up doing was having to redo the prison system, which, anybody here been in prison? Even for a night? Who would admit it? Who would admit it? Who's been in prison here? At least for a night. I know Ivan will, for sure. We're children of the 60s, so we've been in prison. So the point of the story is that there was no single view of that prisoner. That prisoner was a number. We talk about rehabilitation today. We have an agreement that the criminal justice system has to be reformed. But those people were numbers. They were not people. And the information about those individuals was in 43 different databases. And I had no money to solve the problem because I'd been told that the budget to fix it with ETL tools, middleware tools, application development tools was close to $100 million, and my budget was $13 million for IT per year. All right? So I stumbled on an idea, quite honestly, many years ago, and I said, maybe if we treat the prisoner like a consumer with personalization, just getting enough information about that individual so that we can understand the next best decision about that individual, maybe we get somewhere, all right? And then we brought this to Health and Human Services in the same way, trying to address the issue from the standpoint of, hey, this person's a recipient, a consumer. How do we actually address their ability to solve a problem? And here's what killed me. First of all, prisons are really horrible places. I mean, it is a moral outrage what happens in our prison system today in the United States. And you all know the statistics, and we're the largest incarcerator and all that kind of stuff. But then I started working on Health and Human Services with some of my colleagues here that are in the room on what was called the Illinois Framework. And we did a survey, and I spent a weekend reading these surveys, which were asking a whole bunch of questions, but this was the critical question. How can your social service experience be better? And what came back was, when I walk in the door, if you know who I am. It seems so obvious. There was this story of this woman with 3 children, and she described her day with barely enough bus fare, 3 small kids, trying to work a part-time job, going to all the different offices to get the recertification to feed her kids. Right? It's a ridiculous situation, totally ridiculous situation. But we've made progress. In the healthcare field, what have we done? 82% of healthcare today now has electronic records. That's a really big step. I think it's a huge step. We know here, not everywhere else, but we know here, and many of our professional colleagues know that these two things need to come together, right? The question is, how do you actually get that single view? You need a golden record. You need one simple record with just enough information in it that tells you who that person is, such that the next best decision can be made about that individual on their behalf. Does that make sense? Integration is bad. Case management systems are where good information goes to die. You follow me? Right? Legacy case management systems, integrations, middleware, ETL. Why would it take 3 to 5 years to build an eligibility system? Why are you paying $100 million to build an eligibility system when by the time we finish it, by the way, we will probably have everybody on health getting the benefits that they need. 20 million people already, because of the Affordable Care Act, are already being taken care of and are insured. Do you follow me? So what can you do to change that? The way that you change that is you put together just enough information so that Ethel knows where everything, what has happened in summary with this individual, and they don't longer have to spend the next 2, 3, 4 days, 6 weeks, or 6 months to get eligibility figured out by calling everyone, collecting all those documents. Nick Lyons' presentation were you not outraged at that application? How long that was? That is a sin. That's a moral sin, all right? To be able to do it. Or Mr. Wilking from California, who says he can't find a record that shows him who's getting Medicaid and TANF together. So, customer relationship management, certainly what Microsoft's got a great product. There are other products out there. You just need a low-code environment. You can't do a lot of integration. You can't do a lot of application development. Let the old systems die. They do the job. Let them die and move your data out of there. Liberate your data. Put it in a place where human beings can use it, and then you can apply cognitive services to it. What do you think? Yep. Because what's the problem? The problem is the rules and regulations. It's not the technology. It's the business process. It's the administration. It's the workflow. It's the integrations. They get in the way of human beings making good decisions for other human beings, right? So what you need to do, I'm not saying that this is simple, and I'm not saying that all of those other things aren't necessary. I'm not saying throw the rules out, right? What I'm saying is you've already got systems to do a lot of that, and your case management systems for each program, because they're by program, are there to be used. You got to figure out a way to get on top of that and beyond that. So I'm just showing you here what one of those records looks like, and it becomes a service to all of the other case management systems is the approach that we're doing. Alabama's doing this right now. The state of Alabama is taking our technology and from scratch is redoing their entire health and human services system because they could not afford to spend $100 million on an eligibility system. All right? Camden County, so where's my friend Rich Hayes? Got it. Figure this out. So this is what digital transformation is. If you look at what the cloud is, to make it very simple, what the cloud is what in the 20th century we called middleware. The cloud is simply a place to take data that you need, that urgently you need to make good decisions, and move it to a place where it becomes interoperable. And then you begin to optimize the ability to solve problems and drive to the outcomes that you're looking for. Ultimately, you're building a data asset. And if you look at this diagram, I'm working right now with Mecklenburg County. They've come up with an idea called Citizen 360. 60% of their budget goes to health and human services. Most states, 60% is health and human services, right? Except for a handful. And New Mexico said it was more than 60% in their presentation. Look at the intersection of data. Health and human services data, justice and public safety data, and government data, administrative e-government data. There's an overlap. You want to be building that information about individuals with all of the confidentiality, privacy that's required as a data asset so that you can solve your problem. So I'd like to show you.
The U.S. healthcare system is challenged by the task to deliver exceptional, personalized care at a lower cost. Despite spending nearly 1/5 of our gross domestic product on healthcare, we struggle to meet this goal. Financial pressures on care providers are increasing. This isn't sustainable. So how can we deliver high-quality, personalized care that patients deserve, given the cost pressures we face? At Dartmouth-Hitchcock, we've created Imagine Care, a new cloud-based solution built on Cortana intelligence and Dynamics CRM that enables providers to help patients achieve better health. With the help of Microsoft, Dartmouth-Hitchcock is building a technology platform to serve healthcare organizations and patients across the country, setting a new standard for personalized care. Now, using machine intelligence, providers can develop a care plan that's unique to each patient. We can monitor patients from their homes, where data is collected from devices and sent to the cloud, to Imagine Care's 24/7 contact center, where registered nurses continually monitor a patient's health status and potentially serious trends.
Cortana, summarize health status for Ben Andrews.
Ben Andrews' weight has increased more than 2 pounds in the last 24 hours. Please review the home diuresis protocol prescribed by Dr. Phillips.
Patients get reminders and encouragement and dynamic updates to their care plans, improving their health, helping them avoid unnecessary trips to the emergency room, and reducing the cost of care. With support from loved ones and real-time interventions, there is less likelihood of readmission. With Cortana Intelligence and Dynamics, we're transforming the way healthcare is delivered today, improving patient outcomes, reducing costs, and offering an unprecedented level of personalized care.
Hi. I'll introduce myself really quickly. I was the Director of Veterans Relationship Management for the last 3 years, the Executive Director. Before that, I was a Senior Advisor to VA, implementing the first CRM system that we put in place that replaced 13 systems used by the National Veteran Benefits Administration call center. So we used 13 systems to answer one question: what's the status of my claim? As you all know, that was a big issue at VA. Still is a big issue at VA. Today we have an enterprise platform. That was, we built that system starting in 2010. We rolled out the first implementation in 2011, which no one thought we could do, which was a great challenge for me. I come from private sector. I'd never worked in the public sector before. I took that as a great challenge. What we did, and I think when our second group here gets to speak about Agile, is we took business and IT people, we locked them all in a room together, both the users of the system, some of our customers, some veterans. We had union stewards. We had a variety of people all locked in a room figuring out how to build that system. But back to the Golden Record. One of the things, and this first drawing here is from a dear friend of mine at VA, Lloyd Thrower, trying to simplify the picture. As you can imagine at VA, trying to get the health, the benefits, and the memorials group all to agree on who owns what data was a fairly significant problem that went on for multiple years. What we did is we broke that problem down and we looked for what was the common data set to begin with, and that was really about a couple of things. It was about, now I'm going to go to the last slide here. I'll skip over the governance piece. By the way, almost everything that I'm talking about is not about technology, even though I am a technologist at heart. It's all about business rules and people coming together and a sense of urgency. And the thing that we injected into this process was a sense of urgency. We were also helped by several articles in the Washington Post and other places, but it really did help us have that sense of urgency. So what we did is we identified that veteran and the veteran's family by 4 main areas to begin with: identity, contact, contact information, military service, and their demographics, social and economic demographics. We added the fifth bucket, which is probably hard to see up here, which is the 360-degree view of the veteran. We use our CRM systems. As I said, we now have an enterprise platform with 14 instances. We use it for the suicide helpline. We use it, it's almost rolled out. We use it for health call centers. We also use it for education. We use the same data for that veteran. The idea of knowing who that veteran is and keeping the contact record. So I'd love to talk more about it, but I'm going to pass this on, right? Okay. Thanks.
Hi, everybody. A lot of you folks I know, my role has changed, but the name is the same. I would like to take an aside and aim a personal comment at the Secretary. Sir, it was a fine 4 years. I will say it was honestly the best of my professional career, and I would like to thank you for it. So, taking on that, I gotta put the glasses on too. Yeah, I'll go beyond Microsoft, don't worry. Note to self, great products, little work on the time management. So this is my slide I like to refer to as good projects gone bad. You know, I think Undersecretary talked about it this morning. When you look at IT projects, they are really challenged. And even the good ones have a really slim probability of seeing the light of day. And by light of day, on time, on budget. You know, if I kind of jump to the end shot, this is off of data from the Standish Group, 2015, that 11% of projects really get to on time, on budget. Now, the vast majority, 89%, some will stumble across the line, some will get there, but they will be very cost prohibitive, cost challenged, or in best case, maybe functionally incomplete. So those are a couple of points to think about. When I look at some of the detail numbers, 60% of projects out there experience some level of cost overrun. And when you look at the degree of that cost overrun, it's almost double, 189%. You know, it's a pretty radical amount. And the last bucket I'll mention is the 29% that blow up on the launch pad. You know, I grew up in the Apollo mission, so I still have a visualization of that idea, and that's a pretty horrific idea. So, yeah, I think we're all looking for what's a different way to do it. And if I couldn't have asked for a better tagline this morning than what the Undersecretary mentioned, static requirements in a dynamic world. You know, that's really one of the challenges you have with kind of the classic waterfall model. You know, even if the state does a great job, the vendor does a great job, and we both do positive work on understanding requirements, the problem is the rest of the world doesn't hold still. You know, that political constituencies change, needs change. The reality is when you look at an extended schedule, some other variable is going to happen. So even though we do a great job in a waterfall of collecting all the requirements and then locking people away and building something over a multi-month, week, or month, year, longer than year time frame, what comes out the other side really doesn't get the end. Agile takes the whole other side of the idea, and that is, let's keep the time frame short. Let's often show results so that if needs change, we can adjust course accordingly. You know, let's be Columbus finding the new world and adjust course as we need to along the way. So iteration over iteration, the ideas are refocusing. Now, this is a Mythbusters conversation. So the first Mythbuster, and I don't know, have you ever watched Mythbusters? Are you Jamie or the other guy? I don't know that story if you ever watched Mythbusters, the TV show. But the first myth is, can you really use Agile to scale a project of scope? Can you use it to be something meaty? And again, knowing that I'm now a vendor, I felt a little bit of performance anxiety that you might not trust me as much as when I was a state person. So I brought a state person with me, or a former state person, in the sense that I'd like Judge Payne to talk about some of the magic wink, wink, in Indiana's child welfare system, and really what you did there, sir. Would you please?
Yes, thank you. Is it green? You press the button? Yeah, it should be.
It's on?
There it is.
How many of you been to Indiana? Can I see a show of hands? Then you all know that we have a mile-wide moat and a mile-high wall to keep new ideas and programs from coming into our state. We're fairly conservative, so the fact that we even understand or hear the word Agile several years ago was frightening to us. But we were forced into that because we had a spectacularly lousy information system for our caseworkers. And it wasn't until I came to Stewards of Change and Daniel had a brochure that listed a bunch of states, their cost, their type, and how much they were cost to maintain, and Indiana was twice any other state in the country, that we came to the conclusion we needed to change. So we started to do that and failed miserably, then opted out of the SACWA system, which, as many of you know, meant we weren't going to get any federal reimbursement for moving forward, and we were facing a penalty. But we decided to do that anyway, and as a part of looking at what we ended up doing, we arrived at these 7 important threads in putting this tapestry together because we had no prior pattern for it. We could find no other example in Child Protective Service particularly that this was done at that time. So the first thread was leadership at the highest level. And that meant that it was important since this wasn't just another project, just another thing we were doing, this was the footprint we would leave, that it should be at the highest level. So I took that responsibility on as my project. And that meant everyone who was working on it knew that if we weren't successful, it was my fault. I would take the blame. So they could be creative, they could work hard at it, and they could move forward without worrying about what was ultimately going to happen. Second thread was we needed to have a vision. We needed to know what we wanted. The non sequitur, if you don't know where you're going, you might not get there. Or if you don't know where you're going, you might end up someplace else. Or if you don't know where you're going, it doesn't matter how you get there. So we had to have a vision and goal on what we wanted. And only some of those are these 3. First of all, we wanted it to be caseworker-centric. It was our opinion that our system and many around the country are centered around the agency, getting data and information. And we wanted, if you look at a wagon wheel, the hub is the caseworker, the spokes are all of the stakeholders, providers, and others, and the rim is the information around which everyone can communicate. So we wanted to be caseworker-concentric. We wanted to be both useful and usable by the caseworker in the field and wherever they were. And finally, we wanted it to be adaptable, that as we were building it and even after it was implemented, there are changes that happen almost all the time in our system. It needed to be adaptable. So those were our visions and how we would move forward. The next was I needed few direct reports. With everything else that leaders have to do, to take this on was an additional challenge. So I wanted, first of all, a caseworker who knew our practice model, who was very good at it, and was adaptable to changes as we were doing this. Secondly, I wanted someone to be our project manager, project director, the lead guy. And my goal was to give the imprimatur, the authority of the leader, to those people to make decisions at a moment's notice. And third, I wanted someone outside of our agency who was responsible to report to me, to report to the state IT director, to report to the budget agency, and to report to the governor's office on 2 things. 1, if we were doing things well, on time and on budget, and 2, if we weren't doing things well, if we were not on time, and if we were over budget, and to hold us accountable for that. The next was we wanted continuity. Since we were building in this in a different model using Agile, I needed to make sure that we had continuity of those individuals who were building it. We were afraid that if we got 3 or 6 months into it and people left for whatever reason, that we would be lost. So those 3 were first of all told there would be no vacation, no sick time, no injury, no illness. I did give them time off. They could take either Saturday or Sunday. But we needed continuity, and for that continuity, we needed them to document what was happening in the event that something happened to one of them. Next, we wanted to know that reporting up was happening. So it was my responsibility to report up regularly to the state IT director, to the budget agency, and the governor through the cabinet on what was happening so we could make sure we were held accountable for it. Finally, we needed, second to last, we needed a way to resolve conflict, because we understood that in the Agile method of doing things, you're basically flying by your wings, and you have to be able to make decisions, and that creates conflict between what you maybe originally wanted or talked about and what you were getting now. So we had a resolution conflict process that came up to the CEOs, to me and to the CEO of the provider who was building this. And only one time did we use that. About 6 months into it, everybody was pretty tired of compromising and talking and trying to get along, and they decided to dig their heels in. So it came up to us, and after some intense discussion, my wife and I call it increased communication, we finally got to the point where we resolved that and sent it back down with that same intense communication, and they decided never again to come up to us to resolve a conflict. So it worked well. And finally was procurement. And I mean by procurement the RFP, putting together the contract with the provider, putting together and developing, and then finally the implementation. Procurement was critical to us in how we did that. And so we were able to basically overcome all of the barriers. The biggest problem we were concerned about, and the reason we immediately went to Agile, was that we were at limited time. We were within 2 years of the governor leaving office, and we wanted it in place in 18 months so that there were 6 months of continuity as we were ready to walk out the door. And so we basically found a way to get around all of the procurement. We sole sourced it, and we did some other things based upon Indiana's experience when we had a tornado, that we found the state of Indiana could do anything if we called it an emergency. So we were able to overcome a lot of the barriers in that. And so we implemented it July 5th of 2012. It virtually happened without a tick. I sat in the command center as it was rolled out. We had 900 people signed in the first 3 hours. We didn't lose any data that we knew of. It seemed to work well. One example, about 3 months afterwards was traveling the state, and I saw a caseworker working on her machine. So I stopped by to chat with her, and I said, "How's it going?" She said it used to take 3 hours in the old system to put one case in. With our new system, she could put 2 cases in 1 hour. The efficiency and the effectiveness of what we accomplished was incredible, and the caseworkers fell in love with it. Thank you.
Yeah. I mean, that's a great case story. And when I hear the judge speak, just a couple of Agile threads I'll pull out of it. Sir, it's clear you had a product owner, somebody making the key decisions, the hard decisions. You know, that's a key premise to Agile, to good Agile. And let's be honest, there's a lot of organizations out there that say, we do Agile. That's kind of like saying, you know, I make pizza or I do, it's a commodity thing for a lot of people. But to do Agile right, you had a product owner. You took the user's perspective. It's a solution that the users have to endorse and work against. And you were very transparent. You know, the work that got done, everybody stayed on the same plate. And those are really strong tenets of effective Agile implementation. So thank you, sir. I want to move over to a couple other myths. And we'll move these through kind of a little quicker. One I hear a lot, Agile doesn't have a plan. Technically, sir, it doesn't fly by the seat of the pants. I didn't want to correct you too quick on that one, but that it doesn't have a plan, that it lacks methodology and structure. He's in Indiana. He can't give me parking tickets and things now, so I'm safe. Less accountability, that Agile has less accountability, and that there isn't a government contract model to work with Agile. So let's break those down a little bit. So Agile doesn't have planning, Agile doesn't have methodology, or planning isn't in the Agile methodology. Boy, that one's a far from the truth too. In fact, Agile uses your strategic planning that you have in place and that your project planning that you have in place. The idea is that that sets the strategic vision to the judge's position. You know, here's what I want when I want it, the high level vision of it. what Agile also jumps towards is the notion of taking that vision and breaking it down into digestible bites. Doesn't say yet how we're going to do it, but it breaks it down to create the idea of what's the priorities, what's the phasing of the work, and then really starts to engage the work around iteration. So when we take a particular module off and we try to digest it, it works through an iterative process to get it to complete. So absolutely, there's planning in an Agile methodology. Agile lacks organization. Again, very furthest from the truth. Agile actually has a mantra out there. I want to be careful. It makes me sound like the Unabomber when I say we have a mantra. But in fact, Agile has a mantra, but what it focuses on is the people, the relationships. How do we as a team work together? It really focuses on the role of the product owner and what the product owner gets to say and what they get to lead with, what the stakeholders' role is and how they set the direction for the functional need, what the development team does. You know, they really focus on the how to do things. And by making it that iterative loop, we go from stakeholder concepts to a prioritized set of vision through the project owner to implemented work to demonstratable work back to the stakeholders who can look at it and say, you got these parts right and this part not so much, and could you go again? And it's having that kind of focus loop that gets you to a result. So absolutely structure, and it's a role-based structure process. The next myth, Agile doesn't produce documentation. Again, it's a different kind of documentation, or it's a different kind of outcome. Where the classic waterfall model, yes, I fully admit, does a great job of creating a tome at the beginning. And the key part is you do a lot of functional and technical requirements, and you know, you get well, most folks here remember phone books. So sometimes I make the phone book reference, and depending on the audience, I get a funny look if it's millennials. But they come out as like that, and then let's be honest, how many times do we actually go back to those requirements? It's sometimes a little sketchy. And so instead of focusing all that work up front on producing a set of material that has a challenged shelf life, Agile really focuses on the notion of creating user stories and working those stories into a product backlog, and understanding that that backlog is a living document. As you continue to work through your iterations, what's important to you can change in the backlog, and the priorities can change. And again, that reflects that needs change. The world is a dynamic place. Another aspect is Agile doesn't have status reports. Again, it has status, but a different kind of status. Instead of looking at abstract percent completes, it actually looks at things called burn down or functionally operable. It looks at how much of the system is actually working. What capabilities can I demonstrate for you today? You know, what's the best measure of success to actually show running software? And Agile takes advantage of that right up front. The last one is one of the favorite ones, is there's no contract model. The lawyers like this one. That's a little bled out? Thank you. As the secretary would always say, English language was something I was a little loose with, but that's okay. Beg pardon, second language? Si, senor. So moving from the strategic plan that we talked about a minute ago and the project plan, you can use those to really guide your RFP process and develop an umbrella contract. But unlike the old days where you would put a fixed price that would say, I need these features and implemented this way, one option for implementing Agile is to really look at the idea of putting an umbrella contract where you define a pool of resources and a measure of time that you want to work against. And through that umbrella contract, you also include the vision, your vision as the judge mentioned, for what modules you're interested in implementing. So we in the vendor world can look at what resources are needed, and at a high level, what kinds of modules would be required. Putting those two together, we can start looking at the idea of issuing task orders, and those task orders line up to the modules themselves also. And that starts to give us a sense of what work to be done. It continues to evolve in the sense of the task orders now make the jump into the iteration world, where on this order, Thank you. On this order, here's the work we want to get done and the sequencing we want to do it through. And that turns into a set of deliverables. So again, it becomes demonstratable right up front in short order. And so the idea is, from a contract vehicle, you really end up in a situation where you have fixed price and a certain level of contingency together driving the direction of the task order. And all of that comes back to the idea of the umbrella contract to get work done. If the undersecretary was here today, I think he's left. Oh, right there. Yes, sir, I should probably put a California brand on this because I think this is pretty close to what you're doing right now. So with that, Judge, I do want to respect that, give you last shot on comments from our team.
Just to thank you for serving as the Court of Appeals and correcting me. We really didn't fly by the seat of our pants. We had practice models, we had our policy, and those were our roadmap. Well, what I meant to refer to was we didn't have a lengthy written scope of work that often we have. So that's all, Mike, if we can get to questions.
Yep. All right, questions? Got the golden record at Agile. Harold? Yeah.
Just one. So just to clarify about the Agile process, you can't have the little modules unless you have an infrastructure underneath it. So can you explain how you build an infrastructure in an Agile way?
So Agile does not dictate what kind of infrastructure you want to use. There's a lot of different ways you can crack through the infrastructure concern, cloud hosting, local hosting. So yeah, I would split those two apart and say there's an early conversation around what kind of infrastructure you need to think about, and then what kind of application goes on top. Sure, please.
I'm sorry, I know you didn't ask me, but one of the things that we did is we ran multiple sprints. So you can run a sprint that's doing infrastructure that, could be a 3-week sprint, and you could be doing functionality that's a 2-week sprint. So when you think about it, what you have is you have multiple tracks going. So it's not, you can't, when you're doing Agile, don't think about it sequentially. We often do that. It's really much more of a parallelized, I can't even believe I said that right, process.
Yeah, dead on right.
Other questions? Rick? Right here. It's coming.
I was just thinking about the question that Karen raised from the Food and Nutrition Service in terms of Agile apparently being very staff intensive. We hear a lot from states that there's a disconnect between the Fed's enthusiasm for Agile and their ability to go through a procurement process within your lifetime, getting APDs and RFPs approved, and then moving on to the next step. Jim, you were fortunate in that you were able to say that it was a sole source contract, which I think is great, certainly speeds things up. But for others that don't have that opportunity, I'd like to hear the group's sort of reaction to that criticism that the feds themselves are really not in a position to support the great idea that Agile is.
I'll start with that. So I had 27 active projects within Veterans Relationship Management. I had probably 30 different contractors and vendors in that process. In the CRM space, we had Microsoft as a consultant, as one, but we also had Booz, and we also had a small veteran-owned disabled business. So we had all three working together. What we did is we created what we said was an enterprise model that they all had to fit into, and one of the contractors had the ability to, and not the ability, their deliverable was to build out what the enterprise structure and the common set of services were that everyone had to use and people had to contribute. So we did it that way. To build that first contract for those folks to do that, we also had it hosted. That building out the contract took a long time because what we did is we set it up for hosting and for implementation as small, medium, and large components. And we sort of By that time, we had a pretty good experience about what was small, medium, and large, so that we could mix and match. But then we also had the other vendors in there as well. It really takes strong leadership. My background, I'm on the business and on the IT side. I shouldn't have been engaged all the time, but getting all those contractors, and I used to be a contractor when I first came in, getting everyone at the table to understand that the only reason I was there is to have an impact on improving the veterans' access, and using that as my big stick helped quite a bit.